day for practice and review. I'm still looking for ways that we can do practice. But again, I think the app is one of the best ways, at least to get it to recognize these. And maybe we'll do some other games as much as possible to practice. Okay. So we started recording, and here we go. So we will start, let me see, we'll start with incisors first. Most of the handout, we start with maxillary teeth, and then we go to the mandibular teeth. So let's see first about the incisors in general, and then the maxillary uh, central incisor. So this is the maxillary central incisors. In general, all of the incisors, whether they are uh, mandibular or maxillary, you will have how many roots? One roots, right? Do we have any cusps? No cusps, right? One of the main features that we also can find are the form of the mammillans, right? And that's mainly on incisors, not canines. And on the lingual surface, one of the main feature would be cingulum, right? So these are technically features that are for almost all of the anterior teeth. All of them have one root. All of them have no cusps. I'm sorry, wrong. Anterior teeth have cusps and canines. We're talking about incisors, not all anterior teeth. Incisors have one cusp. I mean, one root, no cusps. They have cingulum on the back. They might have mammillans, and they have here what we call also a lingual fossa. So you can see there is a depression on the tooth. And again, in a 3D here, it can be a little bit more clear. You might not feel it on your tooth. And definitely teeth are kind of different. Each one of us have a little bit different set of teeth. But these are the general characteristics as general as we can put them. Okay. So these are the general characteristics for the incisors. Okay. So now let's talk generally or specifically about the maxillary central incisor, this one. So one of the main things is that it is the widest of all of the teeth, all of the anterior teeth. So the maxillary central incisor is the widest. So it has the most wide, because the other ones, the lateral, the canine, they're not as wide as it is. One other thing that we can notice is the angle here, the angle of the incisal and the mesial side. This is the mesial side, and this is the distal side. If you look closer, this angle is usually sharp compared to the distal angle that is more rounded. So again, we're trying to figure out features that would help us with recognizing each tooth, right? So again, sharp angle here and then rounded here. Most of the time, the incisal edge will be kind of straight. Also, we'll have some of these lines. You see these lines here that you can kind of see? These are developmental lines. By the way, all of the teeth almost develop from how many lobes? When they come up at the beginning, how many lobes they would form from? 4. Mainly 4, but we have some of them that develop from 5 lobes, which we'll talk about, specific ones that will develop from 5 lobes. So, for example, the central incisor here have 1, 2, 3, and then the cingulum is the 4th lobe. So that's where it developed from. So these developmental lines that we see them here, technically 1, 2, 3 as well. These are from the developing lobes when the tooth was developed at the beginning. So that is what we have on the labial side. If we flip it on the lingual side, we said we have a cingulum, and then we have ridges here. And that's the nice thing about this website as well, is that kind of gives you some, it gives you some notes about everything. So this is a distal marginal ridge. So we have lingual ridges, distal and mesial. And these are just elevated parts, right, of the tooth that we can see on central incisor. We definitely have a fossa. lingual fossa for the mandible, for the maxillary central incisor, that is clear on here. I think that's the main things about the maxillary central incisor. Again, we didn't want to go too much in depth, but these are the main things that we can be able to recognize it from other teeth. It's wide. It has a sharp angle here on the mesial, rounded on the distal. It has the cingulum on the back, the ridges on the lingual side. So if we flip back here, let's fill up some spaces. So general for all incisors, blank on the incisal ridge, mammillans exactly. What do we have on the lingual side? Cingulum, right? How many roots? One. We have a fossa where? Lingual fossa, right? And the function of incisors? Cutting, exactly. We're good so far, guys. Does that make sense? Right? A good flow of information. Let's see. Now we're talking specifically about the maxillary central incisor. Again, you can see a labial view, a lingual view where we can see the cingulum. Labial, you can see the angle here, the rounded part, a mesial view, a distal view, and an incisal view for all of the teeth, as we go down, just again as a reference. So it is the widest of all anterior teeth. We have developmental lines on the facial or labial surface. These are the lines that we saw. And then we have ridges on the lingual surface. So developmental lines on labial, ridges on lingual, right angle on the mesial side, and rounded on the distal side. Again, most of the incisals, this would be kind of correct for them. You have more rounded distally than mesially, even if they are not as round. But again, distal is always more rounded than the mesial part of the corner of the tooth, which we're talking about here, right? Okay, good. So far, so good. Okay, so let's move on and take a look at the maxillary lateral incisor. So as you can see, it is smaller, right, than the maxillary central incisor. If we look at these labially, you can see it has a rounded edge, right? Technically on both sides. So mesial is more rounded compared to the central incisor. The central incisor has a really sharp edge, while the lateral incisor have more rounded edge on the mesial side. Although when you click on here, it says sharp 90 degrees, but the book that we're using, it says again, it's more rounded. And again, compared to the central, it is rounded, as you can see. So it's rounded mesially and rounded distally, but it's still more rounded distally than mesially. Same things, but less prominent on the facial side. We don't see much of the developmental lines as much as we see them on the central incisor. One root, as we said. And then on the lingual surface, it actually has more prominent features. So we can see more of the cingulum. We can see better of these ridges, the lingual ridges. And we might even see a lingual pit on the maxillary lateral incisor. Okay? And that's that. Let's move on back here. So it is smaller than the central incisor, right? And a lot of these, we compare to the tooth before it. So you'll see that. One thing about it is that it varies in size and shape more than any other tooth except for the third molar, which means, excuse me, which means that, I don't know what's going on here, but yeah, it does not want me to do this. So it varies more than any other tooth. So what happens with the maxillary lateral incisor, it can have a peg shape. So it's not like shaped completely straight. It's like more small and pointy like tooth it can look like. And it also can be completely missing. So if you look at all of the teeth, other than the third molar, which is definitely has the most variation at all, it can come with 4 roots, 3 roots, 2 roots, can be there or not. The second tooth that is have more variation is the lateral incisor on the maxillary arch. It can be completely lost, or it can be as a peg shape, or different things that can happen to it. Okay. The root apical portion usually curve distally, right? Most of the teeth would do that, but this kind of a little bit more clear of the curve. If you look at the tooth here, you see that curve at the end. That's a distal curve at the apical part of the root. How about the angles that we have? Rounded, right? They're both rounded mesially and distally. And this is again talking about this part of the tooth. When we look at it on the labial side, you see this is a round angle here, and this is also kind of round. Again, more rounded than the central, which we have almost a complete 90-degree angle. Okay. More prominent on what side? Lingual anatomy, right? Even we can have a lingual pit. So this is compared to the central. If we ask which one has more prominent lingual anatomy, bigger or more prominent lingual ridges, more prominent cingulum, the one that might have a lingual pit, that will be the lateral incisor, not the central incisor. Okay, all good. Moving on. So let's take a look now at the mandibular central incisors. Mandibular central incisors, these are the smallest teeth that we have in the arch, or the smallest one. The thing about them is they are a little bit hard to differentiate left from right, because you can see they're really almost symmetrical. If you look at them, the angles that they have, technically they're kind of the same. And if you view it in a, side to side, it's almost the same. Not like with the other ones that we saw, like the lateral and central maxillary incisors, when we have more features on the mesial to the lingual side. One other thing is that this is the only tooth that occlude with one tooth on the arch. Remember, we had that question one time. Which of the teeth that will occlude only with one opposing arch, or with one opposing tooth on the other arch? And this is the only tooth that occlude or touches only one tooth when we bite, when we close our mouth. This is the only one that touches only one tooth, which is the maxillary central incisor. It touches the maxillary central incisor. Um, Very shallow and not clear lingual surfaces. So we would not see much of the fossa. It'd be shallow. Um, and it has sharp edges here, again, as I said, because that's what will make it a little bit more difficult to recognize. Still, the mesial usually is less, the distal is more rounded than the mesial, but a lot of time you almost see it like as sharp on in both sides, similar to each other. Okay, so that is that. Let's take a look at the lateral incisor before we fill these up. So the mandibular lateral central making things bad. So the mandibular lateral incisor, okay? Do you think it's bigger or smaller than the central one? It's bigger, right? We said the central is the smallest of the teeth. So it's not like, again, with the maxillary, the lateral was smaller. On the mandible, the lateral is bigger, okay? Generally wider, larger, and then you have the lingual fossa would be uh, more prominent. You can see it a little bit better than the central one. So if we go back and fill these things up, so it is for the smallest, right, teeth in the mouth, not in the arch. It is difficult to identify left from right because it's symmetrical bilaterally. So again, because of the way it is, the small and the sharp crown edges, and these central incisors on the mandible are the only teeth that occlude with one tooth on the opposing arch. No lingual pits, very shallow fossa, and as we said, sharp crown edges. All good, guys? Yes. For the lateral mandibular incisor, so it is, and larger, wider, longer than the central mandibular incisors. The lingual fossa would start to appear more, and we can see it better. Okay, moving on to canines now. Let's see the maxillary canine. We'll talk generally about canines now before we start, and then we'll talk about the maxillary canine. So generally, all canines have how many roots? One. How many cusps? One cusp, right? And again, remember, the canines are the transition from anterior teeth to posterior teeth. That's when we start having, it's really similar in way, for the labial side technically to the premolars, but it's still an anterior tooth. What else? It has a lingual ridge that you can see here. So by having that lingual ridge, again, this is general for all of the canines, we can have two lingual fossas. Instead of one big lingual fossa, now we have a ridge. So it splits the lingual fossa into two sides. So we have two lingual fossa. What else? They are the longest teeth in the mouth, so both maxillary and mandibular. The maxillary is the longest in general, and the mandibular is the longest in the mandible side, on the mandible arch. Um, they are the corner of the mouth, right? We know that. They're the most stable ones because of the length of their roots. And what else? And we have that developmental line that you can see on the labial side. This, one development. Sometimes it's really clear and prominent. And again, definitely for the maxillary more than the mandible. So technically, these are the features. The mandible one, the maxillary one, again, is the longest in the arch. The mandible one is the longest in the mandible, and it has less prominent features in general compared to the maxillary one. So let's take a look at it. You can see it's a little bit smaller. That's the mandibular one. Um, what else? It might have a little bit longer crown than the maxillary one. less prominent features. And that's it. Let's go and fill these up. So now we're talking general for the canines, right? So they are the longest teeth in the mouth, located in the corner. They have lingual ridge and two lingual fossas, or fosses. And then how many cusps? One, roots, function, tearing, right? So if we're good with this, if we look at the central maxillary, I'm sorry, of the maxillary canine compared to the mandibular canine. So we have a ridge on the labial surface, that ridge that I showed you that is usually clear, especially for the maxillary one. On the bone, on our arch, on the maxillary arch, we have something that is called a canine eminence, which you can feel technically on your maxillary side. If you put your thumb on your canine area, you'll see there's a little bit of projection, a little bit of a bump. That is that is the canine eminence. Again, because of the way it is located in the arch in the corner and how long the root is, so it actually gets the bone to bulge a little bit to make that projection, which we call the canine eminence. This is the longest root in the mouth. The cingulum is larger and bulkier than other teeth, and we have developmental lines, which technically what we have in here almost. These are the lines that are on the separate sides. So this is the labial ridge here in the middle, and that's the lingual ridge on the lingual side. These are the fosses, and then the developmental lines technically on the canine shows as a little bit more of a depression on either side of the labial ridge. Okay, for the mandibular, it is smaller but longer crown. The second longest root in the mouth, the longest in the mandible, generally less prominent cingulum and ridges. Okay, let's fill these out. Now we're done with the interior teeth, maxillary and mandibular. Let's talk about posterior teeth in general, and then we take each one of these. So things that we will see on posterior teeth, usually a triangular ridge, and that is technically a ridge. Like we said here, we have a labial ridge and lingual ridge, but for posterior teeth, a triangular ridge, it is from the cusp tip to the central groove, and I'll show you in a little bit. A transverse one is the union of two triangular ridges. And we have a unique ridge that is called the oblique ridge that is unique to the maxillary molars. And the function is to grind or crush. Okay, let's take a look at the maxillary first, premolar. So you can see kind of, if you look at it on the labial side, it really resembles the canine, right? It looks like the canine, but definitely when you look at it occlusally, you can see there is a difference. Because now we have how many cusps? Two cusps, right? The buccal one is longer, as you can see. This is the lingual cusp here, and this is the buccal cusp. The buccal one is longer than the lingual when you look at it. That's again for the maxillary first premolar. One of the main things that we also see is that it has how many roots? Two. So usually, about 60 to 70% of the time, it will have a bifurcation a little bit more on the on the apical side of the root. And it's the only premolar that might have two roots. All of the other premolars most probably would not have two roots. Okay. Um, This is a triangular ridge. So from the tip of the cusp to the central groove. This is the central groove. So on the occlusal side, there's a groove like the pits and fissures, right? The fissure technically that is in the center is the central groove. So the ridge that goes from the tip of the cusp to the central groove, I'm not sure if we can see it better. Yeah, there it is. The ridge that goes from the tip of the cusp to the central groove is called what? A triangular ridge. The union of two triangular ridges, like you can see, we have a triangular ridge on the buccal side and triangular ridge on the lingual side. So the union of these is called a transverse ridge. Does that make sense? Okay. One important feature that we see on the maxillary first premolar is the mesial groove. So if you look here to the side, you see on the mesial side, we have a groove that extends a little bit down. And that is one feature that we can have to recognize that this is other than, again, the two roots, the longer buccal cusp. But this is another important feature, the mesial groove. So it's a groove on the mesial side that extends, and it's mainly for the maxillary first premolar. Okay, I think all good. Let's fill this up. So how many cusps it has? We said two. How many roots? Two usually. And it has a mesial, right? That's the mesial groove that we were talking about. The mesial marginal groove here. That's a feature for the first one, has a triangular and transverse ridges as we saw. And as you can see, the central developmental group, all of them have it. The buccal is the longer cusp of the two, okay? The buccal the buccal cusp is the longer buccal for the maxillary first premolar. Now let's compare it to the maxillary second premolar. That's the first, and this is the second. So what do you think? Is it bigger or smaller? Smaller, right? So it's smaller than that. Does it have that mesial groove that we looked at before? No, it doesn't, right? So it does not have that. How about how many cusps? Two, right? Is the buccal longer or they're almost the same length? Almost the same, right? So you can see the buccal and the lingual cusps kind of the same, not like what we saw with the maxillary first premolar. And that's it for that. Generally, just less distinct features. So how many cusps we said? Two. We know that the buccal and the lingual kind of similar in length. It has how many roots? One. Smaller in general than the maxillary first premolar. And things are a little bit less distinct on here. Okay. Let's take a look. All good, guys? Yeah. Let's take a look at the mandibular premolars now. So starting with the mandibular first premolar. Okay. So it has also how many cusps? Two. And which one is the bigger one or the dominant one? The buccal one, right? You can see it has a really kind of small cusp here. One of the main features that we can see is this groove that is mesiolingual groove. So this is, again, this is the lingual side. It might not be as clear. This is the lingual side and this is the mesial side. There is a groove that extends a little bit from here down to the lingual side of the tooth. So it extends a little bit more down here. I think on the picture, on the handout, it's actually a little bit more clear. We know that it has one root. It has also uh, tri triangular ridges and a transverse ridge, and that is the one that does not cross the occlusal groove. So this transverse ridge, you can see it doesn't go all the way through to the other side. So we have a groove that runs in the middle. Compared to the other premolars, the transverse ridge will go through from one side to the other. The mandibular first premolar is the one that might most probably not have the transverse ridge to cross the occlusal groove. Okay, let's go ahead and fill these information. How many cusps we said? Two cusps. The buccal is the dominant and the lingual is small. The root, we have one root. We have that mesiolingual groove that is important, and the transverse ridge does not cross the occlusal groove. Again, if you see here, this is what I was talking about. That is the mesiolingual groove. It goes from the mesial side to the lingual side. Okay. Now let's take a look at the mandibular second premolar. So, do you think it's larger or smaller? Right? Larger. So, again, compared to the maxillary one, the maxillary, we have the second premolar smaller than the first premolar, correct? And same thing for the lateral is smaller than the central. While on the mandible, the lateral is bigger than the central, and the second premolar is bigger than the first premolar. So this is the second premolar on the mandibular arch. So one thing is, again, it is larger than the first one, right? It has still one root. Same thing as we said. The only one that has two roots is the uh, maxillary first premolar. And if you look here, how many cusps you might see? One, two, three-ish, right? So see, we have a distolingual cusp. And that's why we call these, usually we call them what? We call them bicuspid, right? The premolars, we call them bicuspid. And that's why it's a misnomer, they call it, because some of the mandibular second premolar might actually have three cusps instead of two. Okay? And when it does, it means that it came from five lobes instead of four. Remember, we were saying that all of the teeth, except few, comes from four lobes, right? Developed from four lobes. For the mandibular second premolar that has three cusps, it actually comes from five lobes. Okay? So we will see again here on the handout, it has more of the information. So it is larger than the mandibular first. It has definitely one root, but the crown has two forms. It either two cusps, which we call them an H shape or a U shape, the way that they are formed, like how the central groove would form, or three cusps, which we call them a Y pattern. And I will show you in a minute. So two lingual and one buccal. Like we saw here, we have a lingodistal and lingual cusp, or mesiolingual and distolingual cusps. So 2 lingual cusps and 1 buccal cusp. The one, if it has 3 cusp or Y pattern, we will have it from 5, right. And the lingual cusps are more developed again compared to the mandibular first premolar. Because on the mandibular first premolar, the lingual was much smaller, while here it's technically almost the same length. Okay, we're good. I need to show you a picture of the H, U, and Y pattern later on. Okay, let's take a look at the maxillary first molar. So, first things first. How many roots we have? 3, right? That's for all maxillary molars. And how many cusps? 4, but usually we actually have 5 for the maxillary first molar. So these are 2 cusps on the buccal side, right? Mesiobuccal cusp, whoops, and distobuccal cusp. On the lingual side here, we have mesiopalatal cusp or mesiolingual, and distolingual, that is small. And then we might have a distal cusp as well. I'm sorry, what are we saying? 4, and then the 1 mesiolingual, 1 minor distolingual, and then the cusp of carboli, which you can see most probably here. I'm not sure if it's that clear. So we have these 4. It's clearer on, I think, on the picture. Yeah, it's clear on the picture. So 4 of these cusps that we have, and we have 1 cusp that is supplemental, that is non-functional cusp. If we take a look at the handout.
Oh, on the mesial one?
Yes. Exactly. So mesiolingual, on the mesiolingual side, you'll see a bulge, and you can see it again on your teeth maybe. There's a small bulge there. That is a supplemental cusp that we call the cusp of Carabelli. Okay? It's non-functional, but that's the way it is. So you think, since this have 5 cusps, technically, how many lobes it will come from? 5, exactly. So we can put that in here. And if we go back, it has 3 major cusps, 2 buccal, 1 mesiolingual, and the distolingual one, because it's smaller, it's a minor cusp. And then we have 1 supplemental cusp, which is the cusp of Carabelli. How many roots? 3 roots, 2 buccal and 1 palatal, and that is usually the longest root of them all. And they are the largest teeth in the maxillary arch. Not the widest, the largest. And the maxillary first molar is the only tooth that has a wider lingual surface than the buccal. So if we look at it here, this is the lingual side. So the width here of the lingual side is larger than the width on the buccal side. Usually our teeth have more buccally wide, or more buccally wide than the lingual side of them. These are our cusps. Again, this is the smallest one, the distolingual or distopalatal cusp. It's the smaller one. And again, we have the cusp of Carabelli that is on the side here. And this is our longest root usually, which is the palatal root. Let's take a look at the maxillary second molar. So it has also 3 major cusps and 1 minor, still the distolingual, similar to what we have on the first molar. Also have how many roots? 3, similar. We don't have any cusp of carabuli, right? So we don't have a supplemental. And then it has a heart shape. So when you look at it occlusally, it's kind of look like a heart, right? And you can, huh? Yeah. You can see the cusps, the major ones, and this is the distal lingual cusp that is minor, that is really small cusp. That is the smaller one, right? And these are the bigger ones, especially the buccal. The mesial buccal would be the biggest cusp. And if we look at it here, kind of like a heart in a way, right? Usually the roots are less diverged, not like the maxillary first one. The maxillary first one have more diverged roots. But this one is a little bit more closer to each other and they're less diverged. Okay. What do we have? We have some general things about the third molars. So they would vary in shape and form more than any other maxillary teeth. And the roots tend to fuse into one usually. That is technically for all third molars, even for the mandibular third molars. Okay. Now we're going to talk about the mandibular first molar. This is the one that has also 5 cusps. So if we look at, this is what Melissa told us, right? Corrected us about the other time. So if we look at, well, first of all, definitely we have how many roots? 2 roots, right? And then if we look at the cusps, how many cusps we have? 1, 2, right? 3, 4, and then 5. So these are the major cusps, 2 buccally and 2 lingually, and we have 1 smaller minor distal cusp. That is usually also non-functional cusp. Oh, we didn't talk about the oblique ridge. Remember the oblique ridge on the maxillary, we said it's only for maxillary teeth. Let's take a look at the maxillary first molar. Technically, the oblique ridge is not from one side to the other, not like from one to the other. It's from one, not like from buccal to lingual. It's from mesiobuccal to distolingual, for example. You see this ridge here? So it doesn't go from one to the other like in the front of it. It goes sideways. So that's an oblique ridge, and that is only for maxillary molars. Just to talk about that. Two roots, largest. I guess we talked about this. We know about the cusps, 2 roots, easy to distinguish. Let's see. So it has 4 major cusps, buccal and lingual, plus 1 minor cusp that is distally. Usually the lingual ones are higher compared to the other ones. Usually it was the buccal ones that are higher. Cusps, these are the lingual ones. It has 2 roots, and it's the first to erupt and the largest in the mandibular arch. It might have a buccal pit, and it's made of five, right? Exactly, because we have five. So far, the ones that we know that are made from five lobes are mandibular first molar and maxillary first molar and the maxillary, I'm sorry, mandibular second premolar, right? So three teeth that we can recognize that they come from five lobes, not four. The mandibular second molar, it is smaller than the first one. Also have four cusps. Well, not five. The other one has five. And also two roots. The roots are mesial distal, right? So the roots for the maxillary first premolar is what are what? Buccal lingual roots, right? They go buccal and lingual. The roots for the molar on the mandible, they go mesial distal. And the roots on the maxillary teeth goes two buccal, one lingual. Woo, right? So just talking about the roots location or orientation. You see on the mandible, they're mesially and buccally. On the maxillary arch, we have two that are buccal and one that is lingual, right? And for this premolar, also we have one buccal and one lingual, just to differentiate between how they are actually placed in the arch. So we don't have, the cusps are equal in size technically, so not like this one where we have the lingual cusp longer. So the second one, the cusps are equal and the roots are shorter, and we have a lingual groove and a pit, most probably. For the third molars, they're similar to the maxillary one. They might be fused for the roots, and again, they can come in all kind of different shapes. And at the end, for primary teeth, they are, how many teeth we have? 20 exactly, and they would help to maintain the place for permanent teeth. We would not see mamelons on them, and that is the term that we use for teeth that fall by resorption, exfoliation. Few differences or some differences between the deciduous and permanent. They are whiter, which means lighter in color. Pulp chambers are bigger or larger, which means the pulp horns will be closer to the enamel. And the dentin is thinner and the enamel is relatively thin. Any questions? Again, these have a lot of information. They might look small, but there's tons of information in there, right? So as I said, it's that things, kind of these things that you, as much as possible, you have to kind of go back and look at every now and then to remember things. The more definitely you work in the field and start noticing these things, the more that you kind of remember them after all. But you have to start noticing them. You have to try to start noticing these differences that we're talking about. Yes. Maxillary lateral incisor. Yeah, I have a lingual pit. Any questions? Not on this.
You
This.
said you wanted us to submit something for the brochure. Do you want me to just submit it in the comment?
No, just do it as submission. That's okay. You can always resubmit. So I can view. Can you submit it on the comment? I have to download and. No, man. So I think that's mainly it. I wanted to remind you about um, materials. I did talk to the last group, but as much as possible, guys, look at the video for the handing of the instruments and doing the composite um, procedure. Right? Know the name and uses, because I think we have weeks to practice as much as possible. But again, as much as I can, I cannot run a whole group almost. I mean, we get to that point where we have like 5 minutes each, and we get all of you through. But spend some time, download the handouts. It's there for materials for composite, and try to get to be more familiar with the setup and all of that. Okay. The video is in the handout. I need to give you a direct link to it. I had it as a QR code there on the handout of the composite. Yeah, but I'll put it there. I'll put a direct link on the you know the lab thing, huh? Yeah. So for materials, if you go to lab modules and you see the lab resources handouts, you'll see composite instrument large or small, and it has that QR code. I should have put a link directly to it, but again, um, you can scan it, but I'll put a link anyway. I'll do a link for that. This is the video for it. And again, you have all of that. You have all the instruments they're used, and that will be part of our test as well. Lab test, yeah. The lab test will be setting up composite tray uh, and doing an instrument set an instrument exam, and then you have to know the steps for the composite submit. Giving me the instrument one after the other. Olivia, since you brought us donuts, I'm going to give you the printed version, the printed complete version, limited edition.
I do love to print. Thank you.
Okay, I was thinking about questions to ask you, but I'm out of questions. So. Yeah, I'm too tired for that. Okay, guys. Well, at 11:30, 11:30 back from Ms. Jukes.